Good evening, ladies and gentlemen. Welcome to the history of diabetes mellitus. History of this disorder has been my area of interest for many years, and I had written for the first time history of diabetes while writing the review of literature of my thesis work long back in 1990-91. I am very much delighted to present this topic in front of you, and all of us are very fortunate to have Professor Parving, Professor Ryden, and Professor Gersh amongst us tonight. Professor Parving, my thesis topic was on the use of ACE inhibitors in incipient diabetic nephropathy in 1990. And dear friends, believe me, more than 90% of my references had one name in common, the name of this great person, Professor Hans Henrik Parving. Sir, I am very much delighted to have you here with us tonight. And I thank Dr. Shailaja Kale and Dr. Mardikar for giving me this wonderful opportunity. Now, why discuss the history of diabetes mellitus? It is said that the past helps understand the present and may be a guide to the future. Diabetes mellitus has been in existence since centuries. What are we going to do in the next few minutes? We'll be having an incredibly brief look at the history of diabetes from antiquity to 1800 AD, a vast topic covering 3300 years of history in a short span of time. It will be a glimpse into the past with reference to important clinical details of diabetes mellitus and important personalities in the history of diabetes. Diabetes mellitus, as all of us know, the incidence of this most researched, most studied, most documented, and the #1 killer disease of the future is rising very rapidly. And that is obviously the cause of concern. And that is the reason we are discussing past, present, and future of diabetes mellitus in CAD conference tonight. This disorder is very common in all countries of the world, and all nations, all countries have a diabetic association of their own, right from the United States of America to Australia. But historically, if you look into the different parts of the world, diabetes was known in a specific region of the world from antiquity to 1800 AD. Egypt, from where there is a first mention of diabetes. India, second. Greece, Turkey, China, Rome, Switzerland, and from 1600 AD onwards, the United Kingdom. When we consider history, we make use of the time scale BC AD, where the birth of Jesus Christ is considered as a landmark, and anything before that is considered as BC, anything later considered as AD or Anno Domini, meaning in the name of Lord. There is no year zero. The 1 AD follows 1 BC, and we'll be making use of this timeline, BC AD, during this presentation. BC AD are also referred to as before Common Era, BCE, and Common Era, which is synonymous with BC and AD. The earliest mention of diabetes has been seen in the 3rd dynasty Egyptian papyrus authored by Hazira, who is considered to be the world's first physician, who wrote about the disease, mentioning 2 great emptying of urine, which means or refers to the key symptom in the history of diabetes today. 1000 years later, in 500 BC, Hindu physicians from India observed that the ants and flies are attracted to the urine of people suffering from a mysterious disease that causes intense thirst, enormous urine output, and wasting of the body. And they named the condition as madhumeha or honey urine. Madhuram yacha sarveshu prayo madhvi vamehati sarvepi madhumeha kya madhuryacha tanorita. It means madhumeha is a disease in which patient passes sweet urine and exhibits sweetness all over the body, including the sweat, mucus, breath, blood, etc. Hindu physicians probably developed the first clinical test for diabetes, where the diabetic urine was supposed to be sweet in taste. And perhaps ants deserve the credit for discovering the sweetness of urine. 250 years later, in 230 BC, in Egypt, Apollonius of Memphis, that is the physician of Memphis in Egypt, coined the term diabetes for the first time, meaning to go through or siphon. He described the disease drained more fluid than a person could consume and ascribes its etiology to kidney. Few years later, from 30 BC to 50 AD, a Roman encyclopedic, Aulus Cornelius Celsus, commonly referred to as Celsus, gave the first complete clinical description of diabetes in his monumental 8-volume work, The Medicina, which is a primary source on diet, pharmacy, sugar, surgery, and related medical fields. This part is very interesting. Between 81 to 138 AD, Aretius of Cappadocia, a region in Turkey, a Greek physician, gave the first detailed account of diabetes in his work on the cause and indication of acute and chronic diseases. He wrote, "Diabetes is a wonderful affection, not very frequent among men, being a melting down of the flesh and limbs into urine. The flow is incessant, as if from the opening of aqueducts. It takes a long period to form, but the patient is short-lived, for the melting is rapid, the death speedy. Moreover, life is disgusting and painful, thirst unquenchable, excessive drinking, and one cannot stop them either from drinking or making water. They are affected with nausea, restlessness, and a burning thirst, and at no distant term they expire." This is a wonderful description of diabetes. In 129 to 200 AD, Claudius Galenus, or the great Galen, he published his observation about the disease, and as can be seen from Aretius and Galen's work, the incidence of diabetes in this period of time seemed to be very, very low. Galen describing only 2 cases being seen by him during his entire career, and labeled the condition diarrhea of the urine or diarrhea urinosa, and attributed diabetes to the weakness of the kidney. At the same time, a Chinese physician, Chang Chong King, described the excessive eating symptoms seen in people with diabetes, gave the first description of polydipsia as a feature of diabetes, and described it as a disease of thirst. This part is very interesting, and the time period is controversial. Diabetes has been described in Ayurveda extensively. There is a controversy regarding the time period of Sushruta and Charak. But Charak existed between 200 BC and 200 AD, and Sushrut was later, between 200 AD to 400 AD, according to the great Ayurvedic texts. These two great Indian Ayurvedic physician and surgeon have described or contributed to the understanding of diabetes extensively. Their great text, Charak Samhita and Sushrut Samhita, have mentioned all the details of diabetes, including the causes, the genetic nature, types, clinical features, pathogenesis, complications, lifestyle modification, and treatment. Charak Samhita is thought to be the oldest, but Sushrut Samhita getting translated into English earlier, many of the references of diabetes are found in Sushrut Samhita, not in Charak Samhita. Charak Samhita has mentioned the causes of diabetes as well, like lethargy, lack of physical exercise, excessive eating, and eating too much of sweets causing diabetes mellitus. Genetic nature of it is very interesting to know that the genetic nature of diabetes was also mentioned in Charak Samhita. He mentions Charak is not known whether he was a person or it was a school of thought, but in Charak Samhita there is a mention about offspring being suffering from this disease when one of the parents is suffering from diabetes, and what happens to the offspring if both the parents are suffering from diabetes. So the genetic nature of diabetes is discussed in Ayurveda long back. Types of diabetes has also been discussed by in Sushrut Samhita. He has described Krisha Prameha and Sthula Prameha, mentioning the two types of diabetes, now what we refer to as type 1 and type 2 diabetes. Krisha Prameha was seen in early part of life, early age, in lean and thin individuals, and it was thought to be asadhya rog, means incurable disease. This description matches the type 1 diabetes, what we call today. Sthula Prameha, that is the diabetes, occurs in little late in life in obese individuals and can be modified. So to certain extent, the course can be modified, making use of nutrition and exercise. Diabetes was thought to be originating as a liver disorder, and the mention of this is there in Charak Samhita. Complications of diabetes are also mentioned in Ayurveda. Lifestyle modification. If I discuss it in details, I think the time will be short, but I'll mention few things. In Sushruta Samhita, it is written, a person who walks 800 miles a year, that is 3.5 kilometers a day, is less likely to suffer from this disorder. Charak Samhita mentions diet modification in Sthula Prameha, making them starve or asking them to eat only the grain which is fallen from the bullock carts while the grain is being transferred from one place to another. So what he meant was eat less to prevent, as a prevention from this disorder. Exercise has been stressed upon in Ayurveda. They ask the people suffering from diabetes to walk with chariot. And diabetes treatment in rich and poor diabetics is also differentiated in Charak Samhita. Treatment with herbal medicines, having hypoglycemic properties is also mentioned in Ayurveda. In 600 AD, the Aetius of Amidi, a Byzantine physician whose contributions are rarely noted by the world, left his imprint on the treatment by recommending phlebotomy, narcotics, and emetics. At the same time, from China, Li Xuan noted increased incidence of infection in diabetics and prescribed avoidance of sex and wine as treatment. This is again very wonderful. From 980 AD to 1037 AD, Avicenna or Ibn Sina from Persia, what is known modern Iran, he has provided a detailed account of diabetes mellitus in his exhaustive medical text, Canon of Medicine, and has emphasized on the clinical features considering the abnormal appetite and sweet urine, complications of diabetes, the diabetic gangrene and sexual dysfunction, and recommended treatment with substances having hypoglycemic properties, and also has emphasized on exercise as a treatment of diabetes. Next 400 years, there is little mention in the history on the progress of diabetes. However, in 1425, there is a mention in English literature of the word diabetes. From this period, from 1493 onwards to 1541, a Swiss-German physician, von Hohenheim, who called himself Paracelsus, he observed a white powder when diabetics' urine was allowed to evaporate. Incorrectly concluded that this residue was salt, and he concluded that polyuria observed in diabetes was caused by excessive thirst of kidneys resulting from the salt deposition in kidney. In 1624 to 1689, in United Kingdom, Thomas Sydenham, he gave the first reference of diabetes as a systemic disorder and thought to be occurring as a consequence of chyle from food not completely digested with excretion of the non-absorbable residue. The suffix mellitus was added to diabetes in 1674, and thus the complete term diabetes mellitus was coined by Thomas Willis, an Oxford-trained British physician, in 1674, and the mention of it is available in his book Pharmaceutis Rationalis. Johann Brunner, in 1682, he was responsible to understand the role of pancreas in diabetes. He carried out partial pancreatectomy in dog and observed that the dog had extreme thirst, polydipsia, and polyuria. However, he could not identify this organ as pancreas. Matthew Dobson, in 1776, he actually measured the glucose concentration in urine, and in his work, Experiments and Observations on the Urine in Diabetes, he has mentioned diabetes is a systemic disease rather than that of kidneys. The work of Thomas Willis and Matthew Dobson triggered research in the United Kingdom in understanding the pathogenesis of diabetes. In 1778 AD, Thomas Cowley performed first autopsy in a diabetic patient and published his observations in the London Journal of Medicine. He suggested relationship between diabetes and the pancreatic disease and isolated the sugar moiety from urine of diabetic. If you go through the text which is available, I can understand pancreas atrophico या multiple calculus implantos. I think it means pancreatic atrophy and calculi in the pancreas. Sir John Rollo in 1798, he was the Surgeon General to the British Army, thought that the GIT was responsible for the excess sugar in blood and urine. He studied and documented the effects of various food substances on urine sugar. He observed that high carbohydrate diet yielded more sugar in urine, whereas protein content in the diet yielded less sugar in the urine, and developed a high protein, low carb diet for the patients suffering from this disorder. So, from antiquity to 1800, the research or the mention of diabetes in history is predominantly in the regions which we saw. From 1800 AD till date, the mention of diabetes has been moved in the different regions of the world. Scandinavia, some parts of Europe, United Kingdom and Canada. To sum up, diabetes was known in antiquity. So it was recognized as an entity in 1552 BC. Few clinical features, complications and lifestyle modification has been mentioned in history ranging from antiquity to 1800 AD. 1800 AD onwards, the pathogenetic mechanisms underlying this disorder and the advances in treatment that will be covered by Professor Radin, and the future will look into the cure of diabetes. Like this sunrise, and I am sure centuries later, if such symposium is held again, the diabetes will be discussed from antiquity to cure. Thank you.